The broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Pamela Walker. For those of you that have joined us thus far, we will begin the formal presentation right at 10 a.m. Thank you. Good morning and welcome to the Washington Wellness's second quarter training. It's titled, It's About a Million Washingtonians. And what that represents is the number of Washingtonians 13 and older that use tobacco and nicotine products. And my name is Pamela Walker. I'm representing the Washington Wellness team in the Employee and Retirees Benefits Division at the Washington State Healthcare Authority. I'll be moderating the session today, as well as sharing an overview and some additional information about the promotional toolkits that we're offering you to promote tobacco prevention and cessation in your workplace. Ginny Schweitzer is also joining us from the Washington Wellness team. She will be co-moderating and facilitating the webinar process. And I'd like to begin by sharing with all of you that the Washington Wellness team continues to explore and develop opportunities to promote tobacco prevention and cessation in the workplace. And this is driven by the fact that tobacco and nicotine remains the leading cause of preventable death and disease in Washington. And that's more than alcohol, suicide, illegal drugs, motor vehicles, homicide, and AIDS combined. And additionally, the ongoing rise in popularity of the vapor products continues to change the tobacco landscape to evolve into new ways of people becoming addicted to nicotine. And then lastly, but very importantly, it's a very important time to promote quitting smoking due to the COVID-19 global pandemic. Initial research is showing that people who smoke may be more likely to develop serious complications with this virus. So our overall purpose and what we'd like to accomplish today is to bring you up to date on the current issues and impact of tobacco use, also provide an overview of the tobacco cessation health plan benefits that are available at no cost to employees and their eligible family members. And of course, introduce you and give you an overview of the toolkits we've brought together and developed for you to promote tobacco prevention and cessation in the workplace. Okay. So what we've done to accomplish those objectives, we've had the opportunity to bring a special guest panel of speakers, and they represent represent the Tobacco and Vapor Product Prevention and Control Program, and also Kaiser Permanente Washington members will be joining us, Kaiser Permanente Northwest, and Optum, our Quit for Life tobacco cessation program vendor. So the first set of panelists, as you see on the screen, from the Tobacco and Vapor Product Prevention and Control Program, includes Jacob Delbridge. He's the Tobacco Prevention Equity and Social Justice Consultant, Nick Fradkin, Tobacco Cessation Consultant, and Stacia Wasmund, who's the Youth Tobacco and Vapor Product Prevention Consultant. So we're going to begin that section of this panelist with Jacob Delbridge, and he's going to be talking about tobacco as not an equal opportunity killer.
Thanks so much, Pam. Yes, my name is Jacob Delbridge, and I work with the Department of Health's Tobacco and Vapor Product Prevention and Control Program. So we call this slide not an equal opportunity killer because we're really getting at certain populations very much being disparately affected by tobacco. In the past decades, where you've seen declines in tobacco use prevalence among certain populations, you definitely do not see the same declines, and certain communities have not benefited in the same way. So that's kind of what we're talking about here in this first section. So as I mentioned, certain communities are disparately affected, and we're going to talk about nicotine addiction and tobacco use in a somewhat broader context. So really the disparities in use of tobacco are the result of intentional marketing by the tobacco industry, and we've seen clear evidence of this in predatory practices that have been evidenced in the community and also revealed in a lot of tobacco industry documents when those have been exposed. Very insidious attempts to target their products to the most vulnerable communities. They've used a lot of subculture and cultural identities to appeal to certain audiences, using musicians, athletes, and community leaders, and even social movements to sell their products. And you know, even the industry documents have said, when it's been exposed, really outrageous statements that officials have stated, such as, "We don't smoke that, SHIT, we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid." There's a direct statement from R.J. Reynolds, tobacco company executive. So it just really gets to the intentionality of what the tobacco industry has been basically all about. Another reminder, tobacco use is the leading preventable cause of death and disease, and nicotine is one of the most powerful addictive substances, the most addictive legal substance there is. It has physical and physiological properties to rewire a lot of developing young adult brains. It affects the reward pathways and can increase lifelong addiction potential for other substances. And actually, those who use other substances like marijuana, alcohol, and opioids are more likely to use tobacco. And just keeping this in mind, that the same communities that are disparately affected by tobacco are those communities are the same that experience inequities across healthcare, housing, education, a lot of and the resulting chronic disease prevalence disparities that they are disparately affected by. So here's an example of industry marketing. You will see some of this is actually very current of where the industry is marketed to specific communities, linking their products with different cultural traditions, Chinese New Year, Cinco de Mayo festivities and events, Black History Month. There's even been intentional marketing called one big project in San Francisco called Project Scum, where they targeted gay men and homeless individuals with advertisements and displays placed in communities and stores. Here you see very intentional marketing towards women. First associating their products with societal weight standards. You see in some of their older advertisements about how it can keep you slender and skinny. And then as the gender equality movement is really taking off, trying to then link their products to these social movements about gender equality and how smoking can make you an empowered person. Here you see very contemporary industry marketing tactics targeted for specific communities, playing on popular music culture, pride events, other supporting local independent farming culture, really trying to link their products with current movements. And as you are all very much aware, I'm sure, vapor product prevalence has skyrocketed, the dramatic rise in youth nicotine addiction and use of vapor products. And a lot of this has been the result of very similar marketing that the tobacco industry and others have taken up. So first we see when in 2013 and kind of around those years that a lot of messaging and imagery really depicts kind of youth having a good time, living carefree, living in the moment, really utilizing a lot of social media, youth influencers, a lot of really different social media online platforms to do this. They've since changed their tactics, given a lot of scrutiny that this industry has faced, to being products that help to be harm reduction, trying to focus their products on being those that help people from moving from combustible tobacco to non-combustible nicotine use. So, however, not only are there other dangerous constituents in these products, there is that users are inhaling, such as heavy metals and volatile organic compounds and formaldehyde and a lot of other ingredients that that Stacia, my colleague, will be going into somewhat later in this presentation. But nicotine concentration levels in general in these vapor products had accelerated extremely rapidly in recent years. Some vapor pods contain as much nicotine as an entire pack of cigarettes. And then different formulations of nicotine that salts that they're using can help pack in even more nicotine and maintain the kind of the smoother inhalation. So a lot of users are not aware of the extremely high nicotine content that they're taking in, but what that is doing is help strengthening and fueling nicotine dependence. In the US, there remains no national or state level nicotine concentration limit or cap like many other countries have. Very concerning are studies showing that youth and young adults may falsely believe that their vaping product is actually nicotine free. Many think that it's just flavorings and some other ingredients and might not actually know that they're taking in high levels of nicotine or any nicotine at all. Menthol and other flavored products, just like menthol and flavored products, have been heavily marketed to LGBT communities, communities of color. The same is happening with vapor products, and they're marketing candy, menthol, mango, cotton candy, all these other flavors to the same young adult communities, and especially to those communities of color and LGBT youth. And it's actually been reported that by youth that flavors are the main attractor for initiating vapor products for initiating and for continued use of these products. So, it's very intentional to have these flavored products. And I think the crux of it is that, cotton candy flavoring is not geared for adult combustible tobacco users to help them quit. it is a product that is designed to get youth interested in these products, initiating these products, and eventually become nicotine addicted as well. And as we don't have a ton of time in this presentation to get into this, but a new product type called Heat Not Burn, which some of you might have heard about, is now beginning marketing and selling. IQOS, you'll see here in this image, is one of the brand names of this product. They're now authorized for sale by the FDA, and I think they're in the Atlanta market. They've been sold internationally for some time now. Their products have been kind of specifically marketed to be alluring to youth, using lifestyle coaches and celebrities to promote their products, similar to how vapor products were first being marketed when they hit the market. So these products are also electronic devices, but they heat actual tobacco leaf, but at a lower temperature, so they're not combusted. But this is actually tobacco leaf, which vapor products are not. They're derived from tobacco, but it's just nicotine. Heat Not Burn products are tobacco leaves that are burned at a lower temperature, but they still contain and can generate carbon monoxide, heavy metals, arsenic, lead, mercury, a lot of other really dangerous contaminants and constituents. And they are actually currently submitting an application to try to have their products be considered beneficial to the public health vis-a-vis combustible tobacco, and that's currently being considered by the FDA. So we will see what comes from that. So getting to just some visual displays about tobacco and nicotine product-related disparities. You can see here, it's a little grainy, but that's the certain particular communities that I briefly touched upon earlier are shown visually in the data in terms of being disparately affected. So you see here that those of lower socioeconomic status, those who have less of formalized education, different people of color communities, especially American Indian or Alaska Native groups, as well as LGBT identifying persons are disparately affected by tobacco, have high relative tobacco use prevalence. The overall prevalence rate was 14% in the state between 2015 and 2017. What isn't also mentioned here or shown here are that individuals with behavioral health disorders who suffer from mental illness or substance abuse issues are also have relatively high tobacco use prevalence, and significantly so. And looking here at youth smoking disparities. So it's a busy slide, I know, but the main takeaway here is that tobacco disparities that we see among adults actually start at a young age. So you see here the same populations of especially American Indian, Alaskan Native, LGBT identifying individuals, and then you look here in terms of those who are who suffer from lower grades. These are all groupings and populations of folks who have a much higher tobacco and smoking prevalence. And this slide right here is just looking at cigarette smoking or other combustible tobaccos such as little cigars or cigarillos. And then we get to this slide here, which is looking at youth vaping disparities. So interestingly, as you can see here, and very concerning, is that the vaping prevalence is high across the board. While there are certain disparities present, and you can see that here with certain communities, the same communities that have been disparately affected by combustible tobacco, you see here with a trend showing that LGBT persons, American Indian, Alaska Native, other Hispanic, as well as multiracial individuals are disparately affected and have high vape prevalence here. So it's, it's currently mapping onto a lot of the tobacco-related disparities, and alarmingly may be a predictor of future disparity trends. But also, alarmingly, as I noted, you see high across the board. With 1 in 4 high schoolers nationally vaping, and even in Washington State, with 12th graders reporting with 1 in 3 reporting using vapor products in the last 30 days. And this next slide is maybe a reminder for some folks, but maybe new for others. So here we're going to talk about second and third hand smoke exposure. So many of you are probably familiar with secondhand smoke exposure, which is, basically breathing in smoke from someone else burning tobacco and being around that smoke. It's been very much well established that secondhand smoke can have a lot of the same health effects that firsthand smoke can have on an individual, such as heart and lung related conditions, other respiratory illnesses and diseases such as asthma, bronchitis, and emphysema, and particularly young children being most vulnerable to these respiratory effects. And third-hand smoke is a term folks may or may not be aware of, and that's when smoke particles are settling on clothing and walls, furniture, other places within an apartment or a house or a car. And even if they're not smoking, even if a person might not be exposed to that smoke in that time, by remaining on the clothes, on the walls, in the furniture, they can actually latch onto the skin and can be absorbed dermally through your skin, and can have carcinogenic properties, and can lead to a worsening of other chronic diseases, and especially the harming of health of children. And it's important to recognize that even if, let's say, a family might not smoke, let's say they live in a multi-unit housing complex, that child may be exposed to fumes that have passed through the vents. They might be in another person's apartment or a common space where third-hand smoke is, or smoke constituents are laid into the walls and on the furniture, and children or adults are touching these and getting exposed dermally to these contaminants. So it's just an important reminder that a lot of populations are disparately affected, not even by their own tobacco or vapor product use, but by others. And just by, for example, having lower socioeconomic status and not having a single family home in which to live in, but maybe more commonly living in certain multi-unit housing complexes, they're disparately affected. So it's really showing how all of these social determinants of health are very intertwined, from tobacco dependence and addiction to looking at issues of housing, food security, healthcare, because these same individuals might not have the same health services and resources to even help prevent or treat the illnesses that have been accompanied with exposure to the smoke or third-hand smoke. So on that note, I will transition this over to my colleague, Nick Fradkin, who is our cessation consultant with our Tobacco and Vapor Product Prevention and Control Program.
All right. Thank you, Jacob, for providing that important background information about tobacco use and how certain populations are disproportionately impacted. I think those statistics and imagery really go to show that smoking and other tobacco use are less emblematic of a lifestyle choice and more representative of a systemic problem of health inequities spanning more than half a century, if not longer. So, as Jacob mentioned, I'm the tobacco cessation consultant, and I am here to help us understand how we start to undo these health inequities. I'm going to posit that treating tobacco use as what it truly is, and that is a disorder stemming from nicotine addiction rather than a mere choice, is a good place to start. All right, so those of you who attended our presentation last year may remember the statistics on this slide, but this year I'd like to focus on the image from CDC on the right, which says, in case you can't read it, quitting smoking is a marathon, not a sprint. So on the one hand, it is important for people to know just how difficult it is to quit. Although about 7 out of 10 people who smoke want to quit, and the vast majority of them try to quit in any given year, less than 10% make it to the finish line, as it were. But on the other hand, should quitting smoking really have to be as hard as running a marathon? As a society, why aren't we trying to shorten that distance? After all, people who smoke are more likely to have been disadvantaged in the first place. I'm not sure how many of you have run a full marathon, but I recently ran a half marathon, and I thought that was plenty difficult, and I was a collegiate athlete. So that's all to say, I'm really not sure if I'd be able to quit smoking without significant assistance. So whose responsibility is tobacco cessation? We know that physicians aren't consistently trained in how to treat substance use disorder and smoking in tobacco use in particular, and substance use disorder is really what tobacco use independence is. Instead, doctors are really good at treating the dozen or so cancers and chronic conditions that smoking is known to cause or exacerbate. Meanwhile, substance use disorder is largely left to chemical dependency professionals and other similar healthcare professionals. Yet we know that half of substance abuse treatment facilities in our own state don't treat tobacco dependence, even though smoking is what's most likely to kill their clients. Luckily, the Affordable Care Act requires health plans to cover tobacco cessation services without copays and prior authorization. But in Washington and other states, the burden for helping people quit has largely fallen on public health, which we know is in dire straits, especially now. Now, I don't mean to absolve sort of responsibility, or people who smoke of all responsibility for quitting. It's extremely important that they have agency and motivation behind their decisions to quit. But my point is to help you all better understand that this is a lot more complicated than a sort of personal choice or a choice to change a health behavior, or even a physician's advice to, quote, quit smoking. Now, if you're wondering what the image on the right is, that's a Google search for the word smoker. And you'll see that no images of people come up, which I think is actually pretty accurate because nobody is actually born a smoker. People who smoke are people, first and foremost. So to answer the question I posed at the top, whose responsibility is tobacco cessation? My answer that I'll suggest is that it's all of ours. And as wellness coordinators, you can help facilitate this change in mindset within each of your agencies. All right, I'm going to turn to what we know about smoking cessation and tobacco cessation more broadly. This past January, the Surgeon General released the first Surgeon General's report on smoking cessation in 30 years. That may seem surprising to you because we actually do get a new report on tobacco use or e-cigarettes, most recently every few years or so. But this one is specifically about the effects of cessation. And I'm going to briefly run through the strongest findings here on this slide. So smoking cessation reduces the risk of adverse health effects. As I mentioned before, smoking is attributable to 12 cancers, cardiovascular disease, stroke, chronic obstructive pulmonary disease, pregnancy complications, you name it. Smoking causes it or exacerbates it. Quitting smoking reduces the risk of premature death and can add as much as a decade to life expectancy. There's also a huge financial burden that smoking imposes on society, and of course, quitting by extension reduces that financial burden, including healthcare expenditures, most notably. So that's all to say that smoking cessation is beneficial at any age. It improves the health status and enhances quality of life. And on this slide, you're going to see something that many of you probably saw last year, which I think is kind of good news, and the Surgeon General's report did corroborate this. The treatment options, again, moving away from just simple cessation and moving towards substance use treatment. We see that self-help can yield quit rates anywhere between 9 to 12%. That can start with a brochure, perhaps, online support, help, just reading through materials and getting basic tips to quit. A lot of people turn to this kind of thing first, and I'll share a sort of unique example of what we're offering in Washington State soon. Behavioral health counseling is sort of the next step up. Quit rates around 13 to 17%. And again, these numbers aren't exactly inspiring, right? And it really just goes to show how addictive nicotine is and how difficult it is to quit, underscoring the statistics I shared earlier. So this can come in the form of face-to-face counseling or telephone counseling. Face-to-face may be individual, may be in the group format. Group format is rarely covered by health plans, unfortunately, but face-to-face, individual, and telephone are generally covered. Medication, this is what treats the physical dependence on tobacco and nicotine. So we got nicotine replacement therapy, and non-nicotine prescription medications, which are a bit more effective than the NRT. But we know that combination medications, for example, the nicotine patch and bupropion, which is one of the prescription medications, would be a valid combination that doctors can prescribe. And then when you combine counseling and medication, that's really when we get the highest success rates for long-term abstinence. The next slide, I'm going to address vapor products. So, people are always asking, what about vapor products? In 2018, which is now kind of ancient history with regard to e-cigarettes, the National Academies of Sciences found that completely substituting e-cigarettes for combustible cigarettes does reduce exposure to numerous toxicants and carcinogens present in cigarettes, which, if you read that again, it's kind of like, well, of course, because you're not smoking cigarettes, but in reality, we know that dual use is very common. Dual use meaning use of combustible cigarettes and e-cigarettes simultaneously. Rarely do we see people switch entirely to e-cigarettes. But again, most recently, the Surgeon General it kind of summarized the evidence saying that e-cigarettes, a continually changing and heterogeneous group of products, keyword being heterogeneous, very diverse group of products. These products are used in a variety of ways, and consequently, it's difficult to make generalizations about efficacy for cessation based on clinical trials involving a particular e-cigarette. There's presently inadequate evidence to conclude that e-cigarettes in general increase smoking cessation. So the bottom line here is that e-cigarettes are almost definitely safer than regular sort of conventional combustible cigarettes. They are not safe. And so the important take home here is to rely on FDA approved cessation medications, which are the ones on the previous slide. On the next slide, we have best practices for tobacco treatment. So this is the Affordable Care Act guideline for a tobacco cessation benefit screening for tobacco use, 2 quit attempts per year consisting of 4 counseling sessions of at least 10 minutes each, paired with a 90-day supply of FDA-approved medication, no cost sharing, no prior authorization. That is all good news. And we've added here tobacco-free policy, which we'll talk about in a bit. The point of a tobacco-free policy is not necessarily to ban smoking, it rather as much as it is to help people quit by creating a supportive environment. And on the next slide, I've got some of the Department of Health's resources. So many of you have probably heard of the Washington State Tobacco Quitline, which provides cognitive behavioral therapy and counseling and medication for uninsured and underinsured callers, and triages to Medicaid and commercial benefits when they have them. That's 1-800-QUIT-NOW. Folks can now register online at quitline.com. I'll explain how this kind of coincides with the health plan's benefits in a minute. And the smartphone app, that's one of the self-help materials I was referencing earlier. It's based on acceptance and commitment therapy. It's free to all Washingtonians. Folks can sign up at doh.wa.gov/quit. We actually just launched a vaping cessation app for teens and young adults, the first of its kind, and we're very proud of that. And we had something like 300 people download it within the first month, so that was a lot. On the next slide, we've got sort of how the Quitline versus Quit for Life works. I know there's a lot of confusion around this, and so this is all to say that anyone can call 1-800-QUIT-NOW, regardless if they have insurance or not, state insurance, through PEB or SEB or not, or the Quit for Life phone number. They get connected to Optum with an intake specialist who collects the health insurance information and triages them to the benefit that is most robust and available to them. So that's kind of the quick overview. I've got colleagues on the phone who are going to explain the Quit for Life program. Currently, the Quitline benefit, we offer 5 calls plus a 2-week NRT patch starter kit, which is very exciting. And I'll leave it there for now and transition to the next slide and talk about opportunities for wellness coordinators. So your roles, I would say, as it pertains to tobacco use independence treatment, the importance of promoting these benefits, the PEB and SEB cost-free treatment options. The Quit for Life program is great. The other programs that the other health plans offer are evidence-based and very, very effective. And they're vastly underutilized. So we want folks to be able to know about these and use them. Create supportive environments for quitting tobacco. Consider promoting tobacco-free, vapor-free policy within your agencies. Promote cessation incentives. So the surcharge, which I'll talk about in a second, looking at that more as a rebate opportunity as opposed to a penalty is perhaps a good way to look at that. Smart health, we'll discuss that in a bit. And of course, educating employees, and we'll talk about how this toolkit we put together for you around World No Tobacco Day. And the impact on the workplace. So Jacob briefly reviewed exposure to toxins with regard to second and third hand smoke. And then the litter, of course, unsightly, but also toxic. I'll skip down to nicotine normalization. Stacia is going to speak to that a bit around vapor products. But what I want to kind of hammer home here is the state's cost of employing someone who uses tobacco currently. It's around $6,000 per year, and that is a lot. It's one reason why the Affordable Care Act allows health plans to charge people who smoke up to 50% more on their monthly premiums. Now, for public employees and school employees, the premium surcharge is $25 per month, which employees pay when they attest to using tobacco when they enroll for health benefits through the state. If you do the math, $25 per month is $300 per year. That's only about 10% of the costs that are offset through this. So still lots of money to be saved societally and also from not smoking and getting treatment. The next slide, I'm just going to briefly show you, this is a new one, tobacco use attestation rates by state agency. So here are the rates at which employees within some of the largest state agencies report using tobacco when faced with the prospect of a $25 monthly premium surcharge. With that in mind, and I'll also remind you that the actual adult smoking prevalence in Washington is around 12 to 13%, but Thurston County is a few percentage points higher. I'll let you draw your own conclusions about these numbers. I'll just say that looks like the average rate reported as 5 to 6% for SEB employees. Yeah, and those are sort of the top 5 agencies and bottom 5 agencies. And next year I'll try to have the SEB employees represented here too. And on the final slide of my section, just going to show that the Department of Health is kind of walking the talk here. We are the Department of Health after all. We do have a tobacco and vapor-free campus policy, and we have started the formation of an employee resource group for folks who use tobacco and vapor products. Hopefully more progress to come there as we get out of this COVID-19 situation and can focus more on these things. But from here, I am going to pass along to my colleague, Stacia.
Thanks, Nick, for providing that information and especially highlighting some of the resources for youth, as we know that they're one of our most vulnerable populations who are currently fighting nicotine addiction, largely due to these products. So on that note, I'm going to talk a little bit about how these products, really vapor products specifically, affect youth and what we're doing to help protect our future generation. So the vapor product industry is constantly evolving, as you've probably seen, with new, modern, and tech-savvy devices. Last year, we were able to provide some real-life samples of what these look like. We're restricted to just pictures this year, but I encourage you to look some of these products up, and you'll probably be really surprised with what you find. There's tons of different names for vapor products. We use this term because that's the way they're defined in Washington. They can be disposable or rechargeable. The popular products right now are the pod mod or pod-based systems. These are partially disposable. They can be partially disposable, meaning you throw away the cartridge, like what Juul uses. Juul is the one in the middle on the top picture. And then you have the fully disposable ones, which the bottom 2 pictures are new from this year because they're really kind of growing in popularity. There's the Posh brand and Puff Bar, and the idea is after you use it one time, you throw the whole thing away. So again, last year it was really about Juul. It had the majority of the vapor product market share. Many of you have probably heard about this product and its popularity among youth. One thing that they all have in common is that they deliver a very high level of nicotine, especially these pod-based systems. So there's four main ingredients in an e-liquid. There's nicotine, which is highly addictive, especially for youth because their brains are still developing and they're much more susceptible to addiction. Vegetable glycerin and propylene glycol, these are used in cosmetics and food items, and the ingredients are deemed as generally recognized as safe. You'll see GRAS labels sometimes on these products by the FDA, but you know, these are really for ingestion and not for inhalation, which is completely different. And then there's flavors. So there's thousands of flavors available. Jacob touched on some of this in his presentation. Many of them are targeted to youth with the sweet candy flavors. And then there's tons of other chemicals. They contain ultrafine particles, volatile organic chemicals, heavy metals, formaldehyde. So again, it's really not just water vapor. There's chemicals and nicotine in the aerosol, and to top it off, there's also chemicals that weren't originally added to the liquid because the chemistry of heating the liquid up produces dangerous byproducts as well. So with all of that in mind, the long-term studies of health effects could take decades, as it did with tobacco products, but we do know that there are some short-term health effects from the aerosol. I'm saying aerosol, it's important to say that because it's not just water vapor, contrary to what the industry advertises it as. So the aerosol can aggravate respiratory conditions, it can have damage to blood vessels, it contains nicotine, which is really harmful to youth and young adults especially. And there's been studies showing that exposure to aerosol increases coughing and wheezing. There's also a big difference between ingesting these certain ingredients as well as versus inhaling them. And although it's not a common occurrence, vapor products also pose risks of explosions from the lithium-ion batteries that are used, as well as nicotine poisonings. So just to show what we're dealing with in terms of youth use of these products, here's a chart of the increase in use for 8th, 10th, and 12th graders in Washington. This is from the Health Youth Survey, which is given every 2 years. So the rates have increased significantly between 2016 and 2018. You can see that, almost a third of 12th graders are using vapor products. Also, the majority of youth who reported using these products are also using nicotine, and they also report using marijuana as well. So a lot of things going on. It's also important to note that the perception of harm of using these products is only 35%, comparing that to 74% from smoking one or more packs of cigarettes daily. So youth tend to not think that these products are very harmful, and that largely has to do with how and where these products are marketed. If you want to learn more about what these rates look like in different counties, you can go to askhys.net. It's a really great resource. You can make fact sheets for all different counties, school districts, and you can see the statewide data as well. So if you're interested, you can just let me know and I can send you the instructions after this presentation. We saw this change on the national level as well. This is what has sparked the Surgeon General and the FDA to refer to youth use of vapor products as an epidemic. So 1 in 4 high schoolers altogether are vaping on a national level. And we saw a 78% increase among high school youth and 48% increase among middle school youth of using these products. We haven't seen an increase like this of any substance in 43 years. So it's definitely got a lot of attention, and rightly so. The next Health Youth Survey is going to be administered this fall in 2020. It's done every 2 years. Obviously, with everything going on with the COVID-19, I'm not sure, what's going on with that. We're going to see, but If it continues to be administered this fall, we will see what the rates look like in early 2021 when we get those results. So there's been a few state and federal changes just this past year to help with this epidemic. We now have Tobacco and Vapor 21 in Washington, which has gone through the legislative session for the past few years, but it was finally passed last year and implemented the first of this year. So January 1st made it illegal to sell tobacco and vapor products to anyone under 21. And we say tobacco and vapor 21 in Washington. You usually hear tobacco 21, but we define these separately in our state. So if you follow the legislative session at all this year, you'll know that there was an attempt to ban all flavored non-THC vapor products to address the rise in nicotine use and addiction among youth, the governor's executive order, and the EVALI outbreak, which was the e-cigarette or vaping associated lung injuries. The bill was really dismantled throughout the legislative process, and it actually never ended up making it to the House or the governor's desk, so it didn't go through. So that's on the state level. And on the federal level, in December, the federal Tobacco 21 law went into effect, so it became illegal to sell tobacco products to anyone under 21 across the U.S. This was shortly after our state law was passed. And then the federal government announced in January that they would prioritize enforcement efforts for certain flavored vapor products. So this is really important. A lot of people think this was a full-on flavor ban, but it only pertains to the pre-filled cartridge-based nicotine-containing pod products. So that's a mouthful, but it's basically those Juul-style pods that have nicotine in them. Nicotine-containing is mentioned because the FDA only defines vapor products as those that contain nicotine. And so, you know, this does exclude a lot of different products. It excludes tobacco and menthol flavors as well. So there are some gaps in this. Those fully disposable products that I showed on that first slide, the Puff Bar and Posh brands, as well as many other vapor products and accessories, will remain on the market, as you can see from the list on the slide here. So enforcement activity started on this on February 6th. I mentioned that Juul products were part of this enforcement action, but since menthol and tobacco are excluded as flavors, those Juul flavors are still allowed. So if you see those in stores, those are still allowed as long as they're menthol and tobacco. It is worth mentioning that empty Juul compatible pods are already being sold, and they can be filled with any flavored e-liquid. So, you know, the industry is always trying to get a step ahead, right? With any kind of federal or state change in law, making different products to fill in for some of the gaps. And so you can see that there are some policy efforts that have been pushed forward to help protect our youth, and there's still work to do on that front. So the end of May is World No Tobacco Day, and this is a global event led by the World Health Organization, and it is on May 31st of every year. The goals of this event are to raise awareness on the harms of tobacco and vapor product use and to discourage the use of tobacco in any form. So as wellness coordinators, you can really help promote this. The 2020 theme is protecting youth from industry manipulation and preventing them from using tobacco and nicotine. So as you heard from Jacob, the industry uses predatory marketing on youth, and the increased rate of youth vapor product use is very alarming. You should have received a toolkit that we put together for you to promote this event. There's going to be a smart health activity and a tile as well that's going to be shared. We included some information from the Surgeon General, some infographics and parent guides on how to talk to kids about tobacco and vapor products. There's some suggested activities and dates for which you can start sending these out. They start a month from now on May 6th. The toolkit is customizable. You can choose from a list of activities and materials, and you can educate your employees on the topics that you learned about today. And now I will turn it over to Pam.
Thank you, Stacia. Thank you to all of you, Jacob, Nick, and Stacia, for that wealth of information and sharing your expertise and knowledge. It certainly underscores and truly supports, again, all of us playing a role and you know, promoting prevention and cessation. So we'll keep moving forward. Before I introduce the next panelist of speakers, I would like to share with you that we welcome your questions and comments. There is time allotted towards the end of the session today to address those questions and comments. So please, as they come to you, please include those in the questions box on the webinar, and we'll look forward to addressing those. So now we're going to start taking a look at tobacco cessation and programs for PEB and SEB employees and their eligible members. And we have a panel of guest speakers that will be giving us that information. We have Kevin Klein. He's a senior workforce health consultant at Kaiser Permanente, Washington. There's Jessica Richards, client manager from Optum, Quit for Life program, and Tammy Keppel with the Worksite Health and Wellness from the Kaiser Permanente Northwest. So I'm going to begin with turning it over to Kevin.
Thank you, Pam, and hello, everybody. Just to reiterate what we've heard so far, it's really important to think about the tobacco cessation landscape before we get into some of the details of the health plan offerings for quitting tobacco. Reiterating that 20% of Americans still smoke. That is, higher than the Washington rate, but we know that it's still around 12, 13, 14% in Washington, which has been pretty steady for a couple of years. So that's something that we need to consider at all times. And smoking does remain the single largest cause of preventable disease and death in the United States. We know that evidence has linked smoking to diseases of nearly all organs of the body. And the Affordable Care Act requires tobacco cessation support for all members. Sorry, it's not moving. Thank you. Reiterating some of what Nick said earlier, why is quitting tobacco so difficult? It's because it is addictive as heroin, cocaine. And most smokers start young, most by age 18, and nearly all, 99%, first try smoking by age 26. We know that tobacco is used to manage feelings and emotions. People use tobacco when they're stressed. They even use tobacco when they're afraid, like now, in this difficult time. We know that smokers who try to quit without support, very few succeed. We saw 7% earlier, but some of them are 4 to 7% on average. And nearly all current US adult cigarette smokers, 7 out of 10, or 69%, reported they wanted to quit completely. But that just states again how difficult the process is. We at KP Washington are also very pleased that the great program we're going to talk about next is the gold standard for Washington and for the nation and Canada as well. It is called Optum Quit for Life, and our program manager, Jessica, is going to take over from here.
Thank you, Kevin. Thanks everyone for having me. So let's talk about the Quit for Life program. The Quit for Life program is clinically proven, evidence-based, serving more than 4 million tobacco users since 1985. So probably before many of us were born. And this includes all forms of tobacco use, smokeless, combustible, and vaping. The program includes a wide variety of tools to support users through their quitting journey, including quit coaches, specially trained in behavioral health change techniques, which we'll take a deeper look on the next couple of slides. Okay, so the Quit for Life program. I'll briefly walk you through the participant experience. So our program includes 5 outreach calls that will typically take place over a 2 to 4 month period, depending on the participant's readiness to quit. The initial step in the process is enrollment, which can be done online or via phone. We encourage enrollment via phone so that you can be connected with your quit coach immediately to prepare your quit plan. During that first assessment and planning call, coaches work to set a quit date within the next 30 days using nicotine replacement therapy to aid in quitting. Coaches will determine participant use and physical addiction to assess the appropriate quit medication, which is usually ready to be accessed via the pharmacy within 5 to 10 business days, in a lot of cases much sooner. Coaches will also discuss previous quit attempts to discover what worked and what barriers got in the way. Our coaches will also discuss physical and social environments, things that could detract or lead to participants going back to smoking. So this could be things such as having ashtrays removed from cars, taking a different route home to avoid landmarks that may trigger craving, things like that. The next few calls are on the quit date and then follow-up calls post-quitting. Sometimes a quit date needs to be reset, and that's okay. Our coaches will continue to work with you until you've met your goals. So participants can call coaches 24/7 if they have questions or need some extra encouragement. Lastly, at the end of the program, around 6 months post-enrollment, we'll attempt a survey call to collect quit and satisfaction information. So this call is pretty important. It helps us continue to improve our program and to see what's also working and what's not, and also to kind of track how effective the program is on quitting. So what our participants get? So we went into this in pretty great detail on the last slide, but to recap, participants will have access to an evidence-based, clinically proven program, which is personalized for users of all kinds, whether that be smokeless, vaping, or combustibles. The program includes the telephonic support via quit coaches who are certified behavior change experts, which we'll talk about in a little bit more detail here soon. But you'll also have access to email, chat online, mobile support, again, providing you a 24/7 service. I also mentioned you'll have access to the nicotine replacement therapy, which we have seen participants are 2 times more likely to quit using such medication. Okay, so what you will learn as part of the program, we've got kind of our 4 essentials to quitting. So quitting at your own pace will not pressure you or make you feel rushed through the program. We're here to supplement your quit effort. So like I mentioned, if we need to reset the quit dates and kind of start over, we can do that as well. Conquering your urges to smoke. So our coaches will provide you with skills to control cravings, avoid or control situations involving tobacco. Third thing on here, using medications so they really worked. Again, we talked about participants being 2 times more likely to quit using the medications, and our coaches are here to ensure you understand the proper use for the most effective support. And then lastly, probably the most important part here is becoming a non-smoker. Of course, quitting is the first step, but becoming a non-smoker is learning to never again have that first cigarette. So with all these practices, we're confident that our members are on their way to a healthier lifestyle that no longer includes tobacco. And then just really quick overview on our quit coaches. I wanted to share a bit of background to just show how valuable they are in helping you become that non-smoker. So all of our coaches have a bachelor's degree in a related field and are certified with 240 hours of training. So that's 6 weeks of dedicated time. Understanding behavior change, tobacco use effects. They also meet the core competencies to become ATUD certified, so that's the Association for the Treatment of Tobacco Use Independence. So they're very experienced and trained in this field. And then lastly, we've got Spanish-speaking staff, translation lines for many other languages. So we're here to support all groups, all types of people. So Kevin, on that note, I'll turn it back to you.
Thanks again, Jessica. We want to talk about quit medications and medication support now. We might want to make sure that you know that we do cover all medications. They do include nicotine replacement therapy, including lozenges, gum, and patches for members that enroll in the program. It includes other medications such as Chantix and bupropion as necessary for the enrollee. Participants that are ready to quit are supported by the coaches, as was just mentioned, on the use of NRT or prescription medication. And always remember to involve your doctor to assure your medications and care are coordinated. And for KP Washington, we get free mail order through medications through our mail order program. But if you don't have coverage, please talk to your doctor about your plans to quit and get help in finding the right medication to support you in quitting. And the Quit for Life program is overall addresses all types of tobacco types and can assist individuals who use more than one. This does include, beyond smoking and vaping, also chewing tobacco, which we did find in some work programs around the state as well. Includes up to 5 proactive calls and unlimited inbound calls for 12 months. You can re-enroll as often as you wish. And Quit coaches are available 24/7. Mobile app and web coaching is available as support, tools, resources, along with phone-based support. Translation services for 200 or more languages, including TTY. And then again, free RX mail order through KPWA. We do want to reiterate to all members and coordinators that all the plans do have points that they can get through their Limeade program. So this is an automatic, and when they enroll in the program, we have reporting that is produced monthly. And for KP Washington, you get 500 points for this program specifically. And for all the other programs that are offered here, we have support and points toward the Limeade program. So always remember that. Then I want to turn it over to Tammy, who is with Kaiser Permanente Northwest in Southwest Washington.
Thank you, Kevin. So I'm here to talk about the resources available for tobacco cessation in Southwest Washington and our Northwest region, which includes Longview, Kelso, all the way down to Clark County, and then over into Portland metro area. Our tobacco cessation program as a whole does mirror Quit for Life. So what we offer is our freedom from tobacco classes. And this is an option that our members have for 1 session or 6. Included in that could be telephonic coaching with our health coaches, who are all trained in tobacco cessation and have the resources and information to help members who want to quit smoking. We also have our online programs through kp.org, and then coverage, as Kevin mentioned, for medication therapy. So access to our programs, there's a couple of different ways that you can reach more information through our health coach line. They can talk to you about what the options are, and that phone number is at the top of your screen. So if you're a member of Kaiser Permanente in the Northwest region and you want to just get more information or get more detailed information on tobacco cessation, you can call that number. We also have our health engagement and wellness services website, which is listed here under freedom from tobacco and telephone coaching. There is a plethora of information in that website. And in addition to the information, you can also sign up to talk to a health coach. So you can do that online, as well as the phone numbers and other resources that are available through that website. So through kp.org, not through the Health Engagement and Wellness Services website, you can go to the actual digital online programs as well. So that's kp.org/THA, and there's information on the tobacco cessation program there as well. And now I'm going to hand it back over to Kevin.
Great, thank you, Tammy. In addition to all the great programs offered at KP Northwest, I wanted to outline what we offer with the other 3 plans that you are offering for PEB and SEB. For KP Washington members, you can join the Quit Life program by calling this toll-free number, or we do have an online registration method as well with quitnow.net at KPWA. For UMP Regents members, you can join the Quit for Life program by calling this number. And then for Premera SEB members, you can go to seb.premera.com, which offers the following tobacco cessation support for preventive coverages, prescription medications, consulting with your physician, or call customer service at the number listed there. And as a reminder for all members, regardless of healthcare coverage or if they have no coverage at all, we do have a great campus toolkit for tobacco-free. Includes tips and resources for your work environment, things like posters, flyers, scripted emails that you can use for sending out information, signage tips, sample policy statements, other promotional materials. This is a really great resource for you to use at any work site around the state. Now I want to turn it back over to Pam.
Okay. Thank you, Kevin, and also Tammy, and excuse me. Thank you, Kevin, Tammy, and I apologize, my mind just went blank, but thank you very much for that very important information on the overall benefits and for tobacco cessation. And this really promotes and supports how important it is for us to understand what resources are available for our employees and to promote those along with our other promotional focus with tobacco cessation so that we can increase the utilization of these programs. So actually, this is the time that we're going to take a break. We're going to take about 10 minutes and give you time to get up and stretch, move around a bit, and rejoin us. And that should be about 11:15. And at that time, we'll look more closely at the promotional resources and toolkits. So we'll talk to you when you get back. Okay, welcome back from the break. This is Pamela Walker again, and I apologize for my bit of a blooper before we took a break. I would like to go back and include everyone that presented on the health plan resources. Jessica, Kevin, as well as Tammy. Thank you very much for sharing your expertise and information about the wellness tobacco-related benefits. And so now I'd like to take a little bit closer look at the promotional resources and toolkits that we're offering for you to promote tobacco prevention and cessation in your workplaces. We have uploaded, those are available in the handout section on the webinar. And so I'm going to go through and expound a little bit more about the tobacco related toolkits and resources. And please know that they are available on our meetings and materials page. And we will also be sending a post-training email that will provide the links to all of the toolkits. And that should be, you should receive that by Thursday the 9th. So as Stacia shared about the World No Tobacco Day toolkit, she gave a nice overview of that. And I would just like to expound and emphasize the customizable aspect of the toolkit that we have, with the tobacco panelists, have brought together an updated World No Tobacco Day toolkit that offers many campaign elements, options, and resources for you to share information about this year's focus of sharing that information about vapor products and the impact on youth. Also, resources and all that you need to educate employees about nicotine addiction and tobacco-related health disparities. And of course, promoting the employee tobacco cessation benefits. So the toolkit will offer activities that you can choose for the actual World No Tobacco Day related event. And we've also provided a series of affordable email templates that you can implement a tobacco awareness campaign through email messages. And again, there are various downloadable promotional materials that you can draw from. So this allows you, in a simple step-by-step approach, to draw from this toolkit and develop a campaign that's going to meet your organization's needs and interest and culture. Stacia also shared that there will be a tile, a Smart Health Activity tile, specific to the World No Tobacco Day. And we will have that a tile available and up on the Smart Health Wellness portal by mid-May. And then Kevin shared a bit of an overview on the Tobacco-Free Campus Toolkit. And the Tobacco-Free Campus Toolkit provides also a step-by-step process for assessing and planning and developing and working towards a campus, tobacco-free campus environment. It draws from best practice workplace wellness standards as an outline for these steps to be taken. And it provides a sample policy statement, a wellness committee toolkit, and many more tips and resources, again, that can help you move towards that goal of offering a tobacco-free campus at your workplace. And then we at the Washington Wellness Program have developed an overall tobacco toolkit, promotional toolkit, and there's two versions for this. There's a SEB version and a PEB version. And there's an overall theme for this promotional campaign. It involves helping people understand what their reasons for wanting to quit tobacco, and emphasizing that it takes several attempts to quit and to don't give up, and the importance of having support through that process, and it also provides on these promotional materials, of course, where they can find information out about their tobacco-related wellness benefits. Each toolkit provides a flyer, a promotional flyer, a digital slide, and a desktop for those. So now at this time, we'd very much like to open it up for questions and comments. And as I understand, Jenny, there are questions, so we could go ahead and proceed with that.
Yeah, so we have one question so far. It is asking if it's required to talk to somebody for the Quit for Life program.
So Kevin or Jessica, could you address that question, please?
I do know that for KP Washington, it is not required because we do have a way you can sign up through online at quitnet.org, KPWA. And they do have web coaching support as well. So if you prefer web coaching, they can continue doing that for the member.
Okay, thank you.
And that's for both programs. So UNP Regents has the same offering.
Okay, are there any other questions, Jenny?
That's the only question so far. I can keep you updated if more are added.
Okay. Well, if there's anyone that's joined us today that also attended the tobacco training last year at this time, that's when we first introduced and offered the World No Tobacco Day Toolkit. And of course, it's been updated for this year's focus. But if there's anyone that utilized any of that toolkit, or anyone else that has promoted tobacco cessation in the workplace or developed a tobacco-free campus policy, we'd really like to hear from you if you have any, would share any of those experiences or have any comments at all about any of that process. Okay, well, if there are no additional questions or sharing of comments and such, we'll bring this to a closure. I would like to also end by saying that I will be sending out a post-training email either by tomorrow morning with a short evaluation questionnaire, and we'd greatly appreciate you taking a few minutes to complete that and return it. We ongoingly want to always improve and best meet your interests and needs as far as the information and resources you need to develop your wellness programs. So we ongoingly welcome your input. So I guess at that, I will wrap it up for the day, and I want to thank all of you for joining us. And I hope that you found this helpful and you feel you can walk away with some resources, information, and knowledge to continue to promote tobacco prevention and cessation in your workplaces. Thank you so much.